Let's talk about cancer. This commentary is in relation to a video that I've made about eating cheese. And I was eating cheese. And this person said, yeah, this is how you activate cancer. Now, where does that stem from? It must stem from that fat is bad for you. Animal fat is bad for you. And that's absolute nonsense. Animal fats are good for you. In fact, cheese is very healthy. And so is butter. Lots of vitamin D in butter, which is very good for you. Lots of cholesterol in butter, very good for you. So if you look at type 2 diabetes, what we are reversing with the carnivore diet, type 2 diabetes has a very high risk for cancer. This is because of the sugar. This is because of degeneration. This is because of insulin resistance. We are reversing type 2 diabetes. We are reversing insulin resistance. And we are reversing inflammation in the body. We are also eliminating all seed oils, which is problematic in the sense that it makes you insulin resistant. And insulin resistance is not only the cause of heart disease, but it's also the cause of many other problems in the body. For instance, it causes inflammation in many organs, like for instance the gallbladder. You get gallstones because of seed oils. And not only seed oils, all the refined foods that you eat, that we cut out with the carnivore diet, those are the things that causes your gallstones as well. The same with kidney stones. It's the seed oils and it's the oxalate foods. About 80% of all kidney stones are calcium oxalate kidney stones. So there are many high oxalate foods that we absolutely cut out with the carnivore diet. So yes, so if you are scared for cancer, you absolutely want to avoid insulin resistance, and you absolutely want to reverse type 2 diabetes, and that is what we are doing with the carnivore diet. But this commentary of yours does not make any sense at all. There is a high risk for cancer, for certain types of cancer, with obesity. So check out video number 90 on my blog, Healthy at Any Size. In fact, there's one study that shows that if you have high levels of insulin, if you have too much insulin, and you have cancer, then the mortality rate is 90%. Your chances of dying is 90% with too high levels of insulin. And you get high insulin by becoming insulin resistant, and you get insulin resistant by eating a high carbohydrate diet. And of course, there is carbohydrates in cheese, but not as much as in plants. So, but cheese is good. Don't overdo it. But cheese is good. But cheese can make you constipated, and cheese can make you fat. Cheese can absolutely make you fat. But if cancer is a risk, you should absolutely lower your insulin levels. And with the carnivore diet, we do it. Absolutely. Proof of that is on my live playlist on my YouTube channel, where I interviewed a type 1 diabetic who halved his insulin with the carnivore diet. Type 1 diabetes you can't reverse, but type 2 diabetes you can absolutely reverse. Check out my live playlist on my YouTube channel, as well as my frequently asked question playlist. Q23 is about fats and about seed oils, about saturated fats and unsaturated fats. Unsaturated fats are the bad fats. Those are the canola and the sunflower. The good fats, the saturated fats, are the animal fats. And there are two studies that were buried because the people that put out those studies, it was the Minnesota coronary experiment and the Sydney diet heart study, and they wanted to prove that saturated fats, animal fats, are bad for you. And in fact, those studies disappeared for 16 years. And when they found those studies, they looked it up. They discovered that the mortality rate of the unsaturated fats, with other words, the seed oils, the sunflower and canola, was 62% higher than the saturated fats. So people were dying more on the unsaturated fats. It ran from 1968 to 1973, 1966 to 1973. And it disappeared for 16 years because they were ashamed of their findings. So animal fats, saturated fats, are good for you.
So if you go to my blog, carnivoreway.blogspot.com, and you search for cancer, in the find on page setting on your Google setting, you'll see I've got plenty of videos. One of them is this video Q51, where I talk about saturated fat and unsaturated fat. But if you go on with that particular one, you'll see video number 19 on my blog. Dr. Sean Baker debunks the red meat causes cancer myth. So check out that video. The videos are numbered on the left, 1 to 129. Video number 22, it's about oxalates and breast cancer. Very interesting video as well. And then you can check out video number 44, where I interviewed Florian, a friend of mine, who has stomach cancer, and he's on his 13th chemo, and he uses the carnivore diet to help him through this difficult period. And his doctors are amazed by his progress and how well he actually handles the chemo as well. He also told me in that particular interview that animal fat is very, very important. Dr. Paul Saladino is a good reference to that. You can follow his videos as well. But check out this particular video. This video is also on my live playlist on my YouTube channel. You'll see I've got a testimonial playlist there, and I interviewed Florian a while back. So if you go to video number 62, Dr. Ben Bickman talks about insulin resistance and the effects on cancer. Very, very important video. You can check it out as well. And then Dr. Sophia Clemens in video number 65 talk about intestinal gut permeability, autoimmune disorders, and cancer survival improved with the carnivore diet. Dr. Sophia Clemens has a clinic where she treats people that suffer from cancer with the carnivore diet. A very important video, number 65, on my blog to watch as well. Then video number 92, healthy at any size. Obesity and being fat increases your risk of heart disease, diabetes, arthritis, mental disorders, and many cancers. This particular video also a very important video to see or to look at. And here's just interesting video number 98 about sunlight and that the sun actually does not cause cancer. There's this, Dr. Paul Mason also talks about this, video number 99, and video number 100. I know Dr. Paul Mason talks about sunlight and the benefits of longevity. He talks about skin cancer in particular. So check out these videos. As always, discuss it with your doctor. Dr. Kendi Berry talks about the proper human diet, and he always say that what would you give any person, does not matter what their condition or their health situation is. And if you consider, somebody that is struggling with the immune problem, maybe they are fighting cancer, what would you give them to eat? Would you give them a typical Western type diet? Would you give them a lot of seed oil to eat, a lot of sugar to eat, or would you rather give them the proper human diet? Now, the carnivore diet forms part of the spectrum of the proper human diet. Any low carbohydrate diet like keto and Banting is a very good way to, or proper, as part of the proper human diet spectrum. So I'm not saying the carnivore diet is for everybody, but there's certainly merit to look into it. And many people that did not fix a lot of the inflammation problems, IBS, and many other problems, like, for instance, Florian that I interviewed in video number 44 on my blog. On my blog, yes, and this live is on my testimonial playlist. His doctor recommended that he does the carnivore diet. So the carnivore diet is sometimes recommended. The interesting thing about the carnivore diet, of course, is that it keeps the bowels quite empty because we don't consume fiber. And of course, there's another thing that we take away is inflammation because there's no fiber. So that is also something to consider. And as I always say, the proper human diet, the carnivore diet, has all the nutrients that your body needs. You can't tell me any supplement or any nutrient that's found in a plant that is essential. Essential means that I absolutely need it, otherwise my body will not work properly and I will get into trouble. You can't tell me one essential nutrient that is in a plant that my body absolutely needs, that I can't find in an animal product. With other words, what remains to be said? What is the proper human diet? Is it fruit and vegetables? No, definitely not, in my opinion, because on the carnivore way of eating, we find 5 things that you can't find in plants. It's collagen, carnitine, which is amino acid for energy, taurine, which is amino acid for the brain and the heart and the nervous system, and vitamin B12 and cholesterol. You can't find those things in plants. So if you don't get sufficient those things in, your body will try to make it from unsaturated seed oils and so forth, and it's difficult to do that because it's tied up with plant toxins and so forth. So anyway, as I said, discuss it with your doctor, and so there's many people that benefited from the carnivore diet while they were on a recovery path with cancer. The question was also asked if red meat causes cancer, and the answer is absolutely no. Red meat does not cause cancer. In particular, there was a study that was done on mice, where they made laboratory mice genetically susceptible to get cancer, and then they put them on a meat diet, and some of the mice were more likely to get cancer. So first of all, it's a study on mice. Biologically, we are more closer in relation to a pig intestines, human beings, than mice. So it was a study on mice. And the second thing is they were genetically modified to be susceptible to get cancer. So that study disqualifies itself, in my opinion, and in many of my doctors' opinion, because, like I said, first of all, it's a study about mice, and human beings biologically are closer. If you look at the organs and the digestive tract and so forth, it's closer to a pig than to a mice. So if you do a study on mice, it's not directly related to human beings at all. And the second thing, of course, is like I said, the mice were genetically modified to get cancer. So it doesn't mean anything to me. And like I said earlier in this video, in the A part, what are the real risks for cancer? It's type 2 diabetes, it is hyperinsulinemia, chronically hyperinsulinemia. That means if you have too high insulin levels in your body, and of course high acid levels also play a role, and the other thing is obesity. There's certain cancers, as I've mentioned, that is associated with obesity. So with the carnivore diet, we reverse type 2 diabetes and we reverse obesity. And we also reverse high uric acid levels. High uric acid levels comes from insulin resistance. Insulin resistance upregulates the uric acid retention on the kidneys, and then you get high uric acid. I've got videos about that on my frequently asked question playlist. Check out Q66 and Q65. Dr. Sean Baker, in one of his videos, made the statement that even if red meat does somehow make you 0.2% more likely to have a risk of cancer, if it is somehow true, but it's not. According to that specific study that I was referring to earlier, where they made the mice susceptible to get cancer. What about all the other health benefits that red meat gives you? It takes away type 2 diabetes. It reduces insulin use in type 1 diabetics, if you do the carnivore diet correctly, with 65%. Check out my testimonial playlist where I interview type 1 diabetics who reduce their insulin use by 65%. So it's all about risk. What is the risk factor for diabetes if you have cancer? In some cases, it is upwards of 65% to get cancer. The risk to get cancer is very, very high if you are type 2 diabetic or diabetic, because of the high insulin levels and because of the high glucose levels. So it's all about risk. And as I said earlier in this video, what would you eat then? Would you eat a diet that is high in fiber? There's also risks involved with that. Check out my videos on my blog, 60 to 68, the risks of fiber and inflammation, and the cancer risks, where my doctors talk about the cancer risks of being inflamed in the bowels and so forth. So those are the things that we are eliminating. Remember, the carnivore diet is the ultimate elimination diet, and that is why we consider it. But as always, discuss it with your doctor. So we as carnivores are not bulletproof. And like Dr. Sean Baker say, we all will die from something, and in most cases you'll see that people often die from something like a heart attack. Death has to have a cause. But do what you can do to minimize your risks. Hypertension, for instance, has a 4.5 risk factor for heart disease, according to a women's health study of 28,000 women over a 10-year period. Metabolic syndrome has a 6.0 risk factor for heart disease. Type 2 diabetes is a 10.7 risk factor for heart disease. And obesity has a 4.3 risk factor for heart disease, according to that study. Those are the things that we are reversing with the carnivore diet. A question that I often get is, what about the injected hormones that they give to cattle to make them grow faster? I've got a video about that, Q14. In short, the minimum amount of animal hormone that you might get in estrogen, for instance, is minute in regarding to the excess amount of plant hormones that you will be getting in if you are on a more plant-based diet, plant toxins, etc. And in comparison, risk factors like heart disease is much higher. Hypertension is much more dangerous than that little bit of hormone that you might get in. But check out the video Q14 on my frequently asked question playlist on my YouTube channel.